How to solve hepatitis B related questions on your exam. I will tell you the easiest way and you will never forget it again on your exam, how to solve it. So there is some rules. First you need to memorize that. The first one is whenever you are exposed to that virus, the antigen will enter your body, and as soon as you are exposed to that antigen, your body will make antibodies against it. This is the first rule. And the second rule is you can decide the chronicity in acute phase on two ways. The number one is on duration. If it is more than 6 months, then it is chronic, and if it is less than 6 months, then it is acute, which is a hard way. And the second one is making based on those antibodies which your body is making against it. If it is IgE, then it is chronic, and if it is IgM, then it means it is acute. So now let's solve that all the questions are related to hepatitis B. So the first one, antigen. There is three antigen your body can be exposed regarding hepatitis B antigen. The first one is hepatitis C antigen, and this is the first antigen which your body will be exposed when you have when you are exposed for the first time ever in your life, and it will be taken by your immune system, and you will make antibodies against it. The antibodies could be IgG or IgM. If and these IgG and IgM will stay there forever in your body. But that antigen you can detect it for a very short time. Maybe you are unable to detect it sometime, but you will never prescribe this anti-HBC antigen on any investigation. Whatever. Let's move to the second antigen. That is hepatitis S surface antigen, which is the surface antigen in when it is positive, you will it means there is infection always. Whenever it is positive, it means there is infection always. And after that hepatitis surface antigen, when you are exposed to, your body again make antibodies against it, and that will be and the indicator of in recovery from that infection. Or if you are never exposed to any antigen of hepatitis B virus, and you still have that surface antibodies against that surface antigen, then it is mean you are being immunized. And the third antigen is hepatitis E antigen. That is the antigen which always comes after hepatitis surface B antigen. Hepatitis surface antigen S, it always comes after hepatitis S antigen, and it always indicate a high replicative state of that virus. Whenever you are exposed to that hepatitis E antigen, it always mean high infectivity, and you should stay away from that. Again, when you are exposed to antigen, your body will make antibodies against it. So the regarding hepatitis E antigen, if it is positive, it means a very high infective state, and if you make antibodies against it, it means that relatively low infective state, but the viral replication is not on peak. So now I will regarding these three antigen and antibodies against it, I will interpret some question or scenarios in front of you. So if the examiner asks you to interpret the case of acute infection, then here is how you would interpret. Since it is an infection, so IG hepatitis surface antigen will always be positive, and since it is an acute infection, so the IgM against hepatitis C antigen will always be positive, and since it is an acute case, so in acute case the transmissibility is very high, so hepatitis E antigen will also be positive. And if they ask you to interpret a case of chronic infection with high transmissible state, let's interpret. uh, since it is an infection, so hepatitis surface antigen will be positive, and since it is an chronic infection, so IgG against C antigen will be positive, and since it is a high infective state, so IG hepatitis E antigen will be positive. And if they ask you to interpret a case of chronic infection with low or relatively transmissible state, then since it is an infection, so it will be a it will be the surface antigen will always be positive, and since it is a chronic infection, so IgG against C antigen will be positive, and since it is a chronic low transmissible state, so hepatitis E antigen will be negative, and antibody against hepatitis E antigen will be positive. And if they ask you about recovery state, so since recovery state is not in active infection, so hepatitis surface antigen will be negative. This will be the first. And since it is a recovery state, so antibody against a surface antigen will be positive. And since he is being exposed previously, so antibody against hepatitis C antigen will be positive, and he is not having a infective state, so hepatitis E antigen will be negative, and hepatitis E antigen antibody will be positive.